Hello everyone. How to select the design of dental implants suitable to your jawbone condition. Yes, my friend, I, Dr. Mayur Khairnar, in this video, I am going to cover a topic by which we decide how and which implant design is suitable for your jawbone condition. The technique which I am going to describe on this video is ABC, that is all on basal cortical, and this is simply based on a principle of orthopedics. If you can see on a right side image, that is a fractured femur bone of your leg, and that's where this fractured segment of the femur bone is stabilized with the help of a fixation screw and a plate. If you compare the right image with the left image is your jawbone where a patient received a fixed teeth, and the teeth is nothing but similar to your fixation plate, and those implants are nothing but a fixation screw on your right side. So if you see structurally, both the images are similar, and ABC technique, that is all on basal cortical, is based on orthopedic principle. So let me take you to more details about ABC technique. So that's how we place a non-parallel implant. We do engagement of the strong quality bone. We load the implants with a rigid prosthesis, and we do it in a 3 to 5 days. So these are different types of implants which are used. There is 2-piece design and 1-piece design. All are used for ABC technique. So I'm going to give you a brief scientific diagrammatic explanation. So suppose this is a jawbone condition, upper and lower jaw. It looks like in 2-dimensional, it looks like an abundant bone, a good bone. But if we see the section, that is the third dimension, that is the front and anterior-posterior, I would say the thickness of the jawbone. So there is a one possibility, it is a good bone width, or there is a second possibility, the width is less. Okay, so if the bone is good width, you can still place a wider diameter implant. It is a 2-piece implant, you can place it, no problem. But if the width of the bone is narrow, you cannot place 2-piece implants. That's where the problem will happen. It can expose the implants in this region, and then if you can see, it can expose the implants in this region, and that's where the real problem can happen. So in thin bone condition, usually what happens is many doctors do the bone augmentation situations, and that's how the bone augmentation situations happens, and the bone augmentation is done. In augmented bone, patient's bone is taken from the lower chin, from the ramus, and then this is transferred to the area where the bone is deficient. Now this is a good technique when only one teeth is replaced, but when it's a full jaw is replaced, this is not a really good technique, because majorly full jaw cases are elderly patients, and it causes lot of pain problems with respect to the bone augmentation. Now here, after bone augmentation, you can place the implant, but there is a probability this bone can get infected, this bone can get resorbed, or this bone can get rejected by the natural own bone. So there is chances of again implant coming into problem is high in that situation, and this get amplified with the smoking. Whereas instead of modifying the bone, why not modify the design of an implant so that it can be conducive even in such a resorbed jawbone. Now if in this situation the implant is modified, the width of the implant in the crest region, that is in the region of the neck of the area of the bone, where is reduced, and the implant is, if you see, it goes down, it is becoming more and more wider. So that is ideally matching the morphology of the resorbed bone. So I'm going to present these two designs in this case, where upper jaw has received a regular diameter implant and the lower jaw have received a single piece narrow diameter implants. So this case was presented with a challenge of a gubby smile. So when a patient was smiling like this, there was a lot of display of the gums. So second challenge was, we had a very less height to accommodate the teeth in between the two jaw, because the space was very less. And the third and most important challenge was, the patient didn't had a time. But because of the ABC technique, we could solve his situations and his problems in 3 to 5 days. So that's the day 1 of the patient's preoperative. All his teeth are lost, and majority all the teeth are compromised. So we decide to extract all his teeth, and all bone levels are incorrect. So we decided to remove his teeth grind the bone level to the ideal level, and then place the implants in the upper and lower jaw. Upper, as discussed, we decided to place 2-piece implants. In the lower jaw, we decided to place 1-piece implant because the bone width was less. This is the laboratory model. This is the left hand side is the model for 2-piece implants, and right is the model for 1-piece implants. In the left, because it is a 2-piece implants, we could have a retrievable solution in the upper jaw where we can take the prosthesis out with the help of a screws, and in the lower jaw it is cemented with the help of a cement. So whenever there is a situation arises, we can easily remove the upper teeth whenever required, but removing the lower teeth is not easy because it is a cement return. So whenever it is a good bone case, definitely a screw return is the best solution. Whenever it is a narrow bone case, definitely a single piece implant is a more viable solution because it avoids the hassles of traumatic bone augmentation procedures. This is the smile of the patient on day 3 after receiving the final teeth. This is the intraoral image of the patient on day 3. Now you must be wondering why this image, the patient healing, what is going to be happening. So I'm going to present 1 year follow-up of this patient sooner. So that's the healing of the patients after giving a teeth, and that's the final teeth to the patients in X-rays. This is a smile of the patients, right and left side, and the front profile of the patients. That's the 1 year follow-up of the patient. Can you appreciate a very good healing around the teeth and around the implant in both upper and lower jaw, and patient is maintaining it extremely well. There is no problem with respect to healing. So that is absolutely well. Can you appreciate the transformation which is there from day 1 to day 3 and 1 year? In day 1, absolutely all gums were visible. The patient's upper teeth is almost touching the lower teeth. Like, it's perfectly impossible to do it in such a less time, but with the help of a ABC technique we could achieve the great results. That is the final of the patients, extremely happy. That's how we achieved 3 more most important goals, and that was the elimination of the gum smile, management of interarch distance. We did immediate loading and gave a prosthesis or a teeth or a new smile to the patient in just 72 hours. So if you like this video and if you find this video is valuable, you can subscribe to our channel. You can also share to individuals who are really in need of such kind of a treatment. So whenever possible, definitely get back to us. We are going to come back soon on our video. So if you find our video really valuable, you can subscribe our channel Dr Mayur Khairnar, where you will be seeing a lot of videos and smile transformation cases, the stories, the testimonials, and a lot of case studies of full mouth implant reconstruction. And if you find these videos really valuable, share it with someone who really needs this kind of a transformation. Till then, stay connected with us on our YouTube channel, and we'll see you next in our video. Thank you so much. Jai Hind, Jai Bharat. Thank you.